My name is Miranda Chrysostomou. I'm working currently as a senior executive officer for PASYKAF. PASYKAF stands for Cyprus Cancer Association and Friends. So my association is a non-profit one and has been offering high quality services to the Cypriot society for, I think, 35 years. Wow. We employ around 120 health professionals and management staff all around Cyprus, and we have 5 offices in every city. So we cover the whole of the island.
Wow, very big.
Yes, we are a big organization, but then again, there's so many cancer patients, so we have to expand and we have to cover the whole of the island. Okay. So what we do is that we offer free of charge services, including psychosocial support with the help of our psychologists and our social workers. Home nursing, we give out palliative care, physiotherapy. We also have drivers that transport patients to the oncology centers. Mm-hmm. And we also have departments that do awareness campaigns and marketing programs. Around 5,000 patients and their families are supported by our services every year. What we did 6 years ago is that we created a GI group, a gastrointestinal cancers group, which has the mission to reduce all gastrointestinal cancer incidents, improve survival rates by focusing on early diagnosis, and improve the quality of life for all patients with gastrointestinal cancers specifically, including pancreatic cancers. We do this by organizing campaigns, awareness campaigns, educational courses, or even conferences for healthcare professionals. Mm-hmm. We do awareness lectures for the public, awareness campaigns, as I said before. We always make sure to safeguard patients' rights so that they can have the best available treatment and ensure that they have access to all the appropriate and needed medication and, of course, high quality consumables, everything they need in for their everyday life.
Wow.
Not very long. We became members officially last September of 2021. So it was 9 months ago. And how did we meet? Well, I was at a conference in Miami with some of your staff, and we actually met, and they told us that they work for PCE and that they actually do everything that we do. Okay. In a European level. Up until then, we were members of the World Pancreatic Cancer Coalition. And it was really difficult because we had to communicate with the USA. You know, they're another continent. They have different hours. They work, you know, when it's morning here, it's really late at night over there. And we couldn't really communicate the way we wanted to. And a lot of other things were quite different. The way they were is quite more on a higher level than what we actually want and can offer to our patients. Mm-hmm. So it was easier to know that there was an association, a European association, yes, that they could understand us and they could, we have the same kind of needs. as an association, we always try to improve. What we want is to improve the lives of pancreatic cancer patients, medically, socially, psychologically. This is what we do. We are a patient-centered organization. So for this exact reason, we are very much interested in keeping up to date with all recent developments on the matter. And the best way to do is to be part of a broader society, a society like yours that is fighting for the same kind of cause.
Mm-hmm.
So being part of a European association like PC, we are given the opportunity to meet and come together with a wide range of stakeholders from other countries so that we can improve care for pancreatic cancer patients.
Okay.
I would say we would expect to communicate with you on a regular basis. And we would also want to receive frequent updates on pancreatic cancer developments, like new policies, new research outcomes, what work's been done on early diagnosis tools, or in general, anything that would benefit patients and help diagnose this type of cancer as early as possible. If we are aware of any developments going on in other countries in Europe, then we can apply this knowledge to our country.
Mm-hmm.
I think the same applies to every other country, I think.
Okay.
So what is PASYKAF has 35 years of experience, first of all, so we know patients and we know what they need. So through this experience, we have gained the trust and respect from our society. Patients are a big part of who we are, and through them we can really understand what their needs are and what we can do to further improve their way of life. So I think just having such a close contact with patients, it's good for any patient organization. We can gain a lot and we can give feedback in order to create, our next steps. So being part of your network, we're able to share best practices that were used, as I said before, and successfully improve their quality of life. Want to see what we can do together and finally meet. I think that would be really nice to just meet, and because I haven't met you before and I haven't met, except the one time that I saw that one member that ended up to this kind of connection, to this membership. I haven't actually met you to actually work and see what we can do together.